Okay, present. We're going to present to you. Good afternoon, everyone, and thanks for taking time out of your day to work with us on reimagining STF and reopening. You can see on this very first slide that it states draft plan. If I could make it a bigger font and still make it fit on the page, I would. Currently, we continue to be working with every department to finalize all our plans in very specific areas. And as soon as we have any update information from this, we will always get it out to our staff and families as soon as possible. Just as we were closing school and knowing that that was one of the most important parts to do for our students last year, many of us also started thinking about how do we reopen school. And we had the opportunity to look at other states across the country, look at other school districts nationwide, and also take a look and start working with other schools in our area. And we knew in South Glens Falls that there were about 11 areas that we were really focused on. And this graphic has been shared with you on your 4-page document that I sent last Friday to families and to staff. It's on our webpage, and you will see this regularly because it grounds us in the 11 important categories that we need to work through in this process. So what we're going to do this afternoon is we're going to walk through each one of these 11 phases and talk a little bit more specifically about where we are as of July 30th in all 11 of these parts. Here is the link. Geraldine, is this the right link?
Yep, it is.
Town Hall 2?
Yes, it's under Town Hall 2. It's the right link.
Okay, perfect. Here is a link to a Padlet. So we will have a back channel going on, and we will be watching the back channel at various points of this to ensure that we are answering things correctly in this area for you. If you have a phone with you, you can simply put your camera up to the QR code and it will take you to that Padlet. I encourage you, I know some of you may have questions right now, but I encourage you to wait to hear each part, and I'm going to put some parts together of the 11, and then we will pause in between each part to double check each area and your questions there for that. So with that being said, we really also want you to remember that our district has been based on 3 themes for a number of years. These 3 themes drive everything that we do. They will continue to be our themes this year, and we'll continue to have conversations around them. Safety. Every student should feel safe in our schools. Our students should feel safe, our staff should feel safe, our families should feel safe sending their kids to us. That has been grounded in all of the work we're doing to get the schools ready to go with all the proper materials so that way we can reopen. Our second theme, mental health struggles affect many of our students, and we need to understand the effects and support all of our students in need. Mental health struggles. We have been out of school since March 16th. We know that each family out there has had different tragedies happen, different things happen with their family, and different ways of handling being in this new situation. However, while we've tried to have connections with all of our students and families, we know that the in-person connections are really what matters the most. So this particular one, when we think about these struggles, we really need to reconnect with our students at every level in as many ways as possible. The second part of this theme is the word all. We need to think about all of our students. And so as we are reopening our plan, we were keeping all of our students from UPK to 12th grade in mind, so that way human connection could be made at every level. Students should be engaged in their learning, and we must provide our students with a variety of opportunities for the changing world. This one is what helped us make the transition a little less hard in March. This one will be the one that we continue to think about when we think about future ready and changing the look and feel of how we do things in a classroom. And this theme will drive us to do that for all of our students. So with that said, our first of our 11 subcomponents is on personal protective equipment. If you've been watching the reopening of any of the phases in New York State, you know that PPE, personal protective equipment, has been a priority in order to reopen anything in any of the phases. So for a while now, we have been purchasing things regarding PPE. Every staff member must wear a mask at all times they are around children, and also when they are around adults where they can't be 6 feet apart. Some staff will be given face shields, gloves, disposable gowns. These staff are the ones that work closely with our neediest of students that may need direct contact support. All students must also wear a acceptable face covering, excluding students who are unable to medically tolerate it. All students must wear a face covering. The only time that it's required where they don't wear a face covering are the recommendations by the Department of Health. The Department of Health sets this guideline and we must follow it. Students do not have to wear a face covering during lunch or breakfast, at a snack time. And we also must provide our students with a face covering break when we are sure that students are 6 feet apart. These breaks will occur in classrooms during instruction because we know that our students will be 6 feet apart from each other during this time. Again, these were both by the Department of Health guidelines, and we must adhere to them. I know in past comments and questions by families, there were certain things around masks that were addressed, and I want to answer them now. One big question is, my son would rather wear a face shield than a face mask. Is that acceptable? Unfortunately, by the New York State Department of Health, they cannot be interchanged. It strictly states only face coverings that are masks can be worn. Another question that continues to come up when we talk with families is, can I use my own? Can it be personally made cloth mask? The answer is yes, it absolutely can be that type of mask. We also will be providing each student with at least one reusable mask. We also will have child size and adult size disposable masks available. So if students happen to forget it before they enter the building, they will be given one there for that. Cleaning protocols. Our custodians, our cleaners, our maintenance supervisors have all been trained on appropriate cleaning protocols based on this guidance. We know that we need to do regular cleaning of high touch areas. We also know we have to do regular cleaning and disinfecting of restrooms, and we have to do this throughout each day because those are high traffic areas. On top of all the training that we have to do and adding of a disinfectant every night, we also have to have plans that if or when a student or staff member becomes positive, we have extra cleaning protocols in place to clean very specific areas. All of these will be found later on in a longer containment planning document that will be part of our long plan we submit to State Ed and the Department of Health. Soon, you will be getting supply lists that may be slightly different than the supply lists you're used to. We cannot share supplies to start the year, so you will be getting individual student supply lists. These supplies will be kept separately in each classroom. They'll be individually labeled through a storage container, a cubby, or an area, and they will be sent home regularly so families can help us clean or disinfect them if possible. Health and safety. Health and safety is broken down into a few areas, and this was something that we definitely needed to get guidance on from the Department of Health before we could make our plans move forward. Staff must be required every day to self-screen and report this to each school. Again, in all of the reopening stages in New York, screening was a mandatory requirement for employers to return to work. We are using Pinpoint Health Screening, which is HIPAA compliant and Ed Law 2D compliant, to be able to answer these 4 questions for this. Students must also be screened daily. It is the recommendation of the Department of Health that this gets done at home with families prior to coming to school. There have been more questions on that statement than any other statement I make this afternoon is on the self-screening. I have to know that our families out there want their students to be back in school. I also know that they want their students to be as healthy as possible and not send them in at this time when even the possibility of being sick or contagious with something is there. Students will be screened by their families at home at least 30 minutes prior to coming to school, and families will be given a screening protocol and a how-to sheet coming soon. Again, an email will come to you every morning. You will answer 4 simple questions, and then reports will come. To the families that are concerned about this, please know, anyone who did not fill this out, a report goes to the school nurse and the principal, and conversations will be had with families who do not fill this out. On top of this, we will also be training our teachers on how to look and screen their students as they enter the building. When they enter the classroom, if they have any of the symptoms that are there, they will immediately be sent to the nurse for a recheck. However, I want to be clear, because temperature taking is HIPAA compliant and is the recommendation of the Department of Health that we cannot save this data, it is important that we partner with our students and our families in getting this done prior to coming to school each day. Healthy hygiene practices is also part of health and safety. We need to make sure we're training our students regularly on how to appropriately wash their hands. We need to make sure we're setting up hand washing breaks and stations throughout the day to ensure healthy hygiene is practiced. We will be giving families a toolkit on how to help their children with hand hygiene and also respiratory hygiene. Hand sanitizer stations are going to be stationed in every classroom throughout the building, and we continue to work on that right now. Also, related to hygiene, we know that the COVID-19 virus spreads from person to person in droplets produced by coughs and sneezes. Students and staff must cover their mouth and noses with a tissue when coughing or sneezing and dispose of that tissue properly. Families, students at the elementary level will also be reviewed by their teachers with them regularly, and supplies of tissues will be in each classroom. A third area of health and safety had to do with social distancing. Mr. Dawkins, do you think you could do the slide and talk about the Department of Health guidelines related to 6-foot distancing?
Absolutely, I can. So as you can see at the top there, all students will be required to maintain a minimum of 6-foot distancing while in school. So because of this, a hybrid model of learning will be utilized to start the school year. And I know that we've been monitoring the town hall questions, and there are questions coming in around social distancing and masks. The district must maintain protocols and procedures for students, faculty, and staff to ensure appropriate social distancing to protect against the transmission of the COVID-19 virus when on school grounds. So we are doing everything we can as a district in order to ensure that we meet this with success as soon as we hit the ground running in September. We are already working to creating smaller student educator cohorts to minimize the mixing of student groups throughout the day. And this kind of touches on the work that some of our reopening committees that have been doing. We have 5 reopening committees. 2 of those are specifically around instruction at the elementary level and at the secondary level. And there will be more information later on in this presentation about those reopening committees and the work that they've done, what that will look like at both the elementary level and at the secondary level. In a circumstance where sufficient physical distancing is difficult or impossible, such as when students enter or exit a school bus in proximity to the bus driver, all individuals, including staff and students, must wear face coverings that cover the mouth and nose consistent with public health guidance. So the key word there is must wear face masks. When social distancing is not possible, when sufficient physical distancing is not possible, all students and staff members must wear face coverings. South Glens Falls must ensure that a distance of 12 feet in all directions is maintained between individuals while participating in activities that require projecting the voice, such as singing, playing a wind instrument, or aerobic activity, resulting in heavy breathing, such as physical education classes. Each school will create a plan for moving students in the hallway. We will also talk about how we have worked to reduce transitions and transition time at the middle school and the high school through our hybrid model and through a scheduling change.
Thanks, Mr. Dawkins. I know that the middle school and high school people that are out there right now did receive individual videos from their principals respectively already on just what a block schedule looks like. And Mr. Modi did volunteer to hold a Zoom meeting with any interested parents to kind of review the process of block scheduling along the way. You can see that this one was a big one for us to hear from the Department of Health on, because this drives how many students we can have in each classroom. And that's what drives our plan in the next section. So with that said, I'm going to pause for a second and I'm going to open our Padlet. I don't know if anybody in my group has any specific questions that they want to put out there for us.
So I can talk to this question because I know it has come up in our other parent forums as well. And it's certainly conversations we've been having with our group. But the idea of non-compliance for students wearing masks in school at all levels. So the question is, what if a student wears their mask under their nose or does silly things like punching holes through the mask to make it easier to breathe? So I guess we can't be clearer that this will be an expected procedure that we will have. An expected process is that all students will be wearing masks when they are in school. If we have students that are unable to follow the protocol of mask wearing, then we will deal with that the same way that we would for any kind of code of conduct infraction in our schools. And so we have an expectation that students will be doing that. We always like to emphasize that when we look at behavior data and we look at the information that comes through at the end of each school year for discipline data, 95% of our students do the right thing and do what they're supposed to do. So it is a small group of students that need reminders throughout the school year, and there will likely be students that need a reminder. If consistently there are individual students that do not follow the protocols, then we will do as we would with any other behavior situation. We'll be contacting parents and our assistant principals, or our principals in the buildings will be working with those families in order to ensure that the situation resolves itself.
I can also tell you there was a question that is new today about the steps that will be taken if someone tests positive in a classroom. Again, we have what's called a containment plan that will be publicized tomorrow, I believe. It will go live with our communication person. And so all of the steps will be there. It's very transparent on that happens. When all of our nurses have been trained on the Johns Hopkins Tracer course, and so they will be working closely with our Department of Health on any situation that arises with a positive case. We do in every building must have an isolation area, and that will all happen very quickly, where a student would go to the isolation area and all of the families would be contacted. All of the decisions made as far as keeping a building open or closed will be based on contact tracing and the recommendations of the Saratoga County Department of Health. I myself will be included in any of those talks, and so we will take those recommendations very seriously and close when necessary for that. There was a question on when Mr. Modi's meeting will happen. He's probably laughing watching me right now. I'm surprised he hasn't texted me yet to tell me, way to go, Miss Orr, thanks for throwing me in again. And he hasn't done that, so maybe he's taking—
I actually did. Well, I actually texted him on the side here, Miss Orr, anticipating it. He does not have a set date yet, but he's thinking right now that it'll be later in August, after we've had a chance to understand how this is going to play out, after the governor has a chance to let us know as a state what his thoughts are, and then more information will be coming out to the high school community about that.
There was a questions on UPK. Right now in these three areas for PPE, health and safety, and the cleaning protocols, they must be treated as if they were kindergartners, first graders, or second graders. So everything you're hearing today will be on that. When we get more detailed information, Laura Van Gilder, the UPK person, will send very specific information out about UPK to all of you in the coming next week.
Ms. Orr, really quickly, can you just clarify again about mask wearing during instruction K through 12? Sure.
So we must provide mask breaks during the day. It's part of the Department of Health regulation for that. And we have to, these mask breaks have to be when we can guarantee they are 6 feet apart. Because of the numbers of students that will be in each room, we believe that during instruction, we will be able to provide mask breaks to our students during instruction. With that said, there are also times during instruction where if they need to do a lab assignment or move through the room into a different center, where students will have to put their masks on because they may be within 6 feet of each other. So we have to provide mask breaks. We're doing it during times of instruction when a teacher can guarantee people are 6 feet apart. I think with those questions, we now need to go into school structure and support and really talk about what is this all going to look like for us in South Glens Falls based on that 6-foot rule. I think one of the things that we need to remember is regardless of the instructional model that we can implement, equity and access has to be the priority for all of us students in South Glens Falls. Because of this, we need to look at certain subgroups because equity and access for them means something different. Equity does not mean equal. It means giving students the resources they need based on their abilities at the time. So we are looking at subgroups such as students with disabilities, our English language learners, students who lack connectivity, and students experiencing homelessness. We're also looking at our very earliest learners because we know that they are just getting adjusted to school. And so we're keeping our eye focused on our earliest learner too. We've had several subgroups in a reopening committee, and all the people with me on this call have been leading various subgroups along the way. Jessica Sabelberg, our Director of Special Education, has been leading the subgroup of special education. Guess that makes sense that you are the facilitator of it, Jessica. And they've had very specific conversations around this that she's going to share with you now.
Hi, everyone. Yes, so we have met, the committee that I've been working with has met about 4 times over the last month or so to go over all of the New York State guidance that's been coming out around special education, as well as the Department of Health guidance and the school guidance that we need to follow. So we have had some pretty in-depth conversations about the special ed population. We are looking at this time at our self-contained group. Those are our kids that are in 611 classes, 1211 classes, 15-to-1 classes. Those numbers are relatively small, so we're looking at being able to bring those kids back full time, 100% of the time. We have enough room to be able to socially distance them. We've also been talking a lot about PPE and wearing masks, and students with disabilities that might have medical issues that prevent them from being able to wear a mask and what that would look like in the classroom. We have a lot of adult support in those rooms as well. So we're looking at additional PPE in those rooms to protect the other people that are working with students that cannot wear masks, such as a mask, a face shield, and a gown when working with those students. All of the other students that receive services within the general education population will have their needs met now that we're looking at a block schedule. All of the mandated minutes on an IEP will be met through the hybrid learning or virtual learning. As we did before, all IEP accommodations and modifications will be met as well. We're also looking at bringing our related service kids back face-to-face, having all of their occupational physical therapy and speech therapy face-to-face in the building, dependent on their schedule. So we still have a lot more to discuss and to work on, some of more of the logistics and specific information as we finalize our plans. But anybody who has a student out there who has an IEP that has specific individualized questions, feel free to reach out and ask me, have that conversation with me, because it really will come down to individual IEPs at this point.
Jessica, there was one comment just now that I did a quick answer on, but I know in some of our speech services and things like that, there's been conversations about the clear masks. Can you just talk a little bit about those conversations to answer a question on the board?
Yes, so we've been looking at specifically speech therapy with students who need articulation therapy, who need to see the therapist's mouth when they're trying to pronounce certain sounds. Also, students who are hard of hearing and read lips. We are looking at PPE of masks that have the clear covering so they can see lips, they can read lips, and they can model those sounds for those students. So we are currently looking at how much additional PPE we might need for those face coverings.
One more question for you, Jessica, since you're already here. It has to do with 504 accommodations. A child with ADD, will there be accommodations made during the block scheduling? And then what about 504 accommodations? Other than that, extra time for lessons, extra explanation, focus prompts, etc.
Yeah. So any student that has a 504 or an IEP, that the adults that work with that student have access to their documents and must follow them by law. So it's not just the special education teachers that need to follow those. So when those students are in classes, the accommodations and modifications are being followed by all adults. It would happen in their block scheduling during their time in class, whether there's a special education teacher in there at that time or not. And it would happen virtually as well. They would do that through a Google Classroom. Maybe some extra time and supports would be built in the Google Classroom for specific students. But all of those things will be addressed in that block scheduling and will carry over whether there is a special education teacher assigned to that actual class or not.
Thank you, Ms. Spellberg. Mr. Dawkins will now talk about our English language learners and the work we've been doing with them.
So our English language learners also fall under the category of students that we are focusing on getting 100% in-person instruction because their instruction following along with the New York State education guidelines for English language learners is based on proficiency in English, and many of our benchmark assessments for successful graduation from high school requires a proficiency in English. We need to ensure that we are working closely to give those students the support that they need. And so we work yearly. We contract with ENL teachers, English as a New Language teachers from our local BOCES. And those teachers give both support instruction within classrooms and one-on-one instruction to our ELL students. We will be continuing to contract with those services. Those teachers will continue to provide services. And as I said, our goal is to work to get those students to 100% in-person instruction so that we can be ensuring that they are getting the most amount of exposure to English and building that proficiency.
So now when we get into the models of instruction and we think about what we need to do based on the PPE, based on social distancing, based on all of the requirements by the Department of Health, we also need to realize that the State Education Department requires us to submit a plan of 100% in person, 100% remote, and a hybrid choice for that. We have to use the Department of Health guidelines to do the best way possible. I know from other parent meetings that were out there, there's some confusion around our models. There's also confusion as to why certain districts can do things one way and other districts can do things another way. I have two stepsons. They go to a different district. My daughter is a student at Ballard, and my other two children are at a different district in a different county. So I definitely watch every county's opening, and I see how each plan is for that. Things that we have to realize that go into the plan is we have to make sure we have enough room to socially distance everyone. So we have to have enough room in each classroom to minimize the numbers. Number two, we have 4 elementary schools with the majority of our students taking a bus to school, which means the number of runs that we have for transportation are significantly larger than either a small school or a school our size that only has 1 or 2 elementary buildings. So that's what also has to go in our plan. A school district just across the bridge of us has mostly walkers. So that helps their plan get to 100% much more quickly. Then there's schools to the south of us that may have extra room in their buildings so they can take a classroom and move it into 2 classrooms. For us in South Glens Falls, we had to look at all of those same things to come up with a plan as of July 30th. So what we're going to talk to you about now is we're going to talk to you about a hybrid model that our plan is to start the year, at the same time offering a virtual model to our students. After that, we're going to talk to you about our hope to get to 100%, especially for our K-5 students as quickly as possible. And then we will also talk about when we have to go to 100% remote learning for that. So there are 2 models that will be going on simultaneously at a given time, and then we'll talk about the other 2 models that we must also try to get to along the way. Geraldine Stellato, our Director of Technology, has been working with our UPK to 5th grade subgroup on all types of models in their program. So she's going to give you a little bit of the history of that subcommittee and then talk about our plan as of 7/30, meaning July 30th. I can't believe it is July 30th right now. We only have 1 day left in July. But she's going to give our plan as of today on how we believe we have to reopen. Thanks, Geraldine.
Hi there. Thanks, Christine. So I met with the Elementary Advisory Committee. It was a great group of teachers that represented staff from all 4 of the elementary buildings. Through the process, we met about 4 times over a month. We met each time for at least 2 hours and talked about many things that had to do with reopening. Our first meeting had to do with logistics. The teachers have great insight on how that will look for their classrooms. Since they're with the students every day, it was great to get their input on the logistics of how we were going to just have kids arrive, have kids leave, how they were going to be together, walk in the halls, all of those sorts of things. The bulk of what we talked about after logistics were our learning models. And the learning models that I'm going to talk to The learning model that I'm going to talk to you about today is our hybrid learning model. What this means is that students would be split into 2 groups. There'll be a group 1 and there'll be a group 2. So if I have a class and I have 20 students in my class, half of them, 10 of them, would be in group 1 and the other 10 would be in group 2. The groups would rotate throughout the week, whether they would have in-person instruction in front of the teacher in the school or remote instruction with that same teacher, but getting instruction at home remotely. We have to ensure that our safety protocols are in place, that students have that 6 feet apart and are doing social distancing properly. And to do that, the hybrid model looks like it'll be the best way and the safest way to start the school year. When students are being taught in person, they'll be taught using all of the tools that the teachers have with technology and their classroom tools. The students that are home will have the same continuity of learning as the students have that are in their classrooms. So there won't be a gap in their learning in their day-to-day instruction. Teachers will be using Google Classroom and other means in order to connect with every one of their students every day, whether they're in-person students or students that they'll be teaching remotely. Teachers will be required to take attendance, that they know the students are actually either in front of them learning or that they have logged into their Google Classroom and are doing some of the work that has been provided for them for their remote learning. Teachers are going to be giving meaningful feedback, which will drive their instruction. The students are going to be learning in all different learning styles, where we will use not only choice boards, we're going to be using traditional assessments and all sorts of ways in order to reach all of the children in all of the different circumstances that they're in. I know, as Mrs. Spellberg said earlier, our hope is that all of our self-contained special ed classrooms throughout the district will remain open, since their numbers typically have a smaller amount of students in their class, and we're hoping for that for the elementary school as well. As far as the hybrid model is concerned, right now, my job in my office is to really work hard for the rest of the summer to help support teachers in order for them to be able to plan and prepare for the beginning of the school year through professional learning opportunities, as well as creating resources for families on how to navigate all the technology tools that are going to be used during the fall.
Mrs. Salato, I feel like this would be a good question for you to answer, because it is around what you just mentioned about toolkits and assisting our families. But one of the questions is always, when we're in this hybrid model of in-person or remote, is will instruction be live streamed? Will it be secondary? Is it pre-recorded? Can you talk a little bit about the work you've been doing with Google Classroom and the conversations you've been having with teachers?
Yes. So as far as instruction, it really is going to depend on the grade level of the class, what they're teaching, the content, and all of that. All of our students, we're asking all of our teachers to use Google Classroom as the platform in order to organize their day and to organize lessons. Some of the lessons may be pre-recorded video, some may be live stream. We do a lot with Google Meet, where teachers can record those lessons and then make those available to students. So there's a variety of different ways that they can reach their students and actually provide the lesson. But again, that's going to look different if you're a kindergarten first or second grader than it would if you're a high school student. We are also creating a toolkit for parents that'll have information, parent guides, how-to videos, all of that, so we can help you through those videos navigate all these tech tools.
Tim Dawkins, our assistant superintendent, has been leading the 6th through 12th grade opening reimagining subcommittee. And obviously, as we mentioned, you've already gotten information on the block, but now how do these kind of come together has really been the focus for his group on that. I can tell you that as we say, we have to do a hybrid, trying to get to 100% and or 100% remote. Getting our 6th through 12th grade to 100% is absolutely the hardest area because of class size, because of lack of space in both the middle school and the high school. We continue to look at those areas, but you know, the hybrid model and the conversations around that are really around a month of time at least. So Mr. Dawkins, can you talk about your group, please?
Yeah, and I had a great group of faculty and staff come together from both the middle school and the high school to discuss this. And I think one of the most important things to remember is that I think sometimes we think about elementary teachers typically as the ones that are focused on, building relationships at the beginning and getting kids down into routines. But that was the first thing that our middle school and our high school folks were concerned about. We went out of school, we closed our school buildings in March of this past school year. And in some ways, that was a blessing because at least the kids knew their teachers. They knew what they were dealing with. The teachers knew the kids. They knew their routines. They knew their personalities, and they had those established relationships. So one of the first things that the middle school and the high school folks are concerned about is, how do we get to know our kids? How do we make sure they know what we're about? How do we build those strong relationships? So that will certainly be a focus as we come back into school, just kind of getting to know each other, focusing on what it means to learn virtually as well as in person. But we did spend a lot of time talking about not only the transition to a hybrid model, but also the transition to that 4-day or that 4-block day, which you've received information about. And our biggest reason for that, well, there's 2 big reasons for that. The first one obviously is to reduce the transition time, the amount of time that kids are coming in contact with each other, the amount of times that adults and adults are passing each other in the hallway. And it's also because it changes the way instruction happens in a classroom. When you increase the amount of time that kids and students and teachers are able to spend together, it becomes a little less frantic than that 9-period, 40-minute class. And so I know that we're really looking forward to kind of slowing things down that way as well. We are, again, like the elementary school, looking at that 50% hybrid model where we have 2 cohorts, group 1 and a group 2, and we would rotate between in-person and remote learning. Our 4x4 block schedule is an A, B, C, D day schedule, where full year courses happen every other day. So for instance, English 11 is a full year course. English 11 may happen on A and C days first period. US history is 11th grade full year course. That may happen on first period B and D days, for example. And so we've looked at a couple of different models for how we're going to bring students in on an every other day in-person / remote. We've looked at the option of having an AA, BB, CC, DD schedule. We've also looked at the option of having an ABCD schedule, and then having the next week be an ABCD schedule for the second cohort. We're still talking about logistics of cleaning days and disinfecting days, and so that would also determine what that model looks like. There is also a requirement that students will check in every day for attendance, and so on those virtual days where students are not in the building, there will still be mechanisms in place for them to show their teachers that they are present and participating in the learning. Again, our self-contained classrooms at the middle school and the high school, those 12-in-1 classes, will be provided 100% in-person instruction, but our students receiving co-teaching, consultant teacher, or resource room will participate in that general education hybrid model, and they will be split within those group 1 and group 2. It's a lot to take in. If you haven't had a chance to watch the videos from Mr. Modi or Mr. Ruby at the high school and the middle school about what the block scheduling looks like, I really encourage you to do that. It is a lot to take in, so we are working on putting a frequently asked question document together so we can continue to answer your questions.
Thank you, Mr. Dawkins. There was one question that just recently came up with the idea that is a 4-day rotation. The 4-day rotation has nothing to do with a 4-day week. So I do not want people to assume that there is a long weekend component every week for students. The only thing that could happen is we may have to pause and do virtual school some days for cleaning purposes. We are finalizing all of our cleaning protocols and reimagining everything related to cleaning. And once we have that done next week, a schedule will go out to you very soon of what September will look like for all ages. And so especially at the high school level, we need to be very clear on what that looks like, and our options are still not perfect because of that.
And the question at the bottom that came in is, will a Monday always be an A day? That really depends on that cleaning day and if that's something that comes into play. If it's a 5-day school week like normal, where the rotation just restarts, it'll restart on whatever day is after the D day. So it may be A, B, C, D, Monday, Tuesday, Wednesday, Thursday. That next Friday would be an A day, but then the following week will start with a B day. So it would be B, C, D. Thursday would be an A day, Friday would be a B day. And so the rotation just keeps happening through the 5-day week model.
Thank you for the clarification. So now, as we talked about, this is currently, as of July 30th, the model we believe we need to put in place for all of our students UPK to 12th grade. By the regulations of the State Education Department, we also have to provide a completely virtual school model. That means we know that there are families out there that are in need. There are families that may be from very medically vulnerable situations and are in high-risk groups and do not want their students around multiple students on any given day for that. So we have created an SGF virtual school, and you'll see on the last line of the slide, that is the direct website there. That link is live and working. There's information there that will be updated regularly. And there's also a link on how to register for the virtual school. One of the questions I get is, do I have to register? The answer is yes. We have to register because we have to know our numbers to know how we are going to be able to do this at this given time. We don't know exactly how the teaching will work because we don't know how many students and families will be interested in this. However, our goal is that we want to make an educated decision, and we want to also be prepared with the same teacher for a longer block of time. So if you are a K-5 parent out there and you want to enroll your student in this, please know that we're hoping you make that commitment through the first trimester. So that way, how we're assessing our students, how we're teaching our students, what we're looking at, how we're modifying anything is all done in the same completely virtual model. For the middle school and high school, we're looking at re-looking at this at the semester mark. Again, for the high school, the reason why we want that is because we want to be able to award some type of credit for each level and have some type of closure for the first and second quarter, so that way credits can be given, and that is there for that. Classes will be full-time, so it is not, a modified schedule. They'll be full-time, they'll be well-organized, they'll be following a schedule based on the grade level. Obviously there will be some flexibility, for working family, especially at the younger levels, but we need to work on that at each level. Google Classroom will be unified. Academic requirements will be equal to what is done in person. There will be eventually an online parent and student handbook, and we will even have a virtual meeting of some kind with all families interested in participating in that. At the middle school and high school level, we know we can cover all core and required courses. We may have a limitation on some of the electives for that, but as we enroll students, we are also looking at their schedules and coming up with scenarios on what their course requests are right this minute. If we can't meet those course requests, we'll be giving options for other course requests, so that way they can continue with their program if they were to come back live in class for in-person scheduling. So I encourage you, because there are questions on this every time. This is not in the place of, this is along with. There is right now a first deadline to this that we're setting up, which is August 7th. Strictly because in order to build this by the first day of school, we need a few weeks to get all of the parts in a row. Building a master schedule usually takes a few months. And so when you're trying to build several of these at the same time, we want to give us a few weeks to be able to make sure it's there. Will it be different teachers that run the virtual classes than the hybrid classes? Again, I can't answer that right now because it depends on the number of sections that we need at the middle school and high school level especially. So we may have one teacher do a class completely virtually as part of their assignment. We may have others that need to do a mixture. We may have some elementary people that are completely only working with virtual students. So there is more to come on that, but it will not be every single teacher in the district that is running completely hybrid and completely virtual at one time. That does not work for us here in South Glens Falls, and we can't possibly make that happen. So there is more to come on the teaching of that. Then we have to give a plan to state on how do we do 100% remote. Okay? The 100% remote does not affect our virtual school. That will continue to run and be on and will be business as usual. What this affects is whoever has chosen in-person schooling, there's only 2 instances when we go to 100% remote. Those 2 instances are the governor and the Department of Health have created a formula that clearly states what the metrics need to be in the capital region for us to remain open. Between August 1st and August 7th, the governor's office will be putting out their first proposal for September and opening for schools. If it meets the metrics that they've determined, at that moment in time, we will know if we will be able to have any type of in-person schooling. However, one of the misnomers out there is that once that is said, it's done deal. That is not true. There's also a 7-day metric, and that 7-day metric is based on if we have to close school for any reason by a region. That closing of school by the capital region will be done by the governor and the Department of Health, New York State Department of Health, and it will be every single school district in the entire capital region setting. So it will not just be South Glens Falls. So that's one way we would go to 100% remote learning. The only other time that we would go to remote learning completely as either a building or a district is if the metrics within Saratoga County cause us to be completely remote. That will happen very quickly in the discussions and the conversations that we have with the Department of Health, and we will quickly move to remote learning and let all of you know in a very similar manner that we did last year. The good news for this is because we already know this is a possibility, our teachers have already been creating pivot plans that will be discussed with your students and with all of you in the beginning of school. So if we have to change to remote, you will be upfront in the know of exactly what that will look and feel like, different than we did last year in March for that. So those are the only 2 ways. That is the only 2 times we'll do that. Obviously, our goal is 100% in person, UPK through 12th grade. Again, it is only July 30th. And as of July 30th, we are in a hybrid model where 50% of the students come one day, 50% of the students come another day. Some of the other data points we need to look at is social distancing and how many extra rooms do we have? Because really our magic number is about 14 students per room. There's a few rooms where we can do a slightly more than this, a few rooms we can do slightly less. Transportation will be a topic we're coming soon, but we have to look at riders on a bus. We should be socially distancing them in transportation, so we really should only have about 22 to 25 riders on a bus. We're meeting with transportation to finalize some of their runs next week to see where we can tweak in hopes that we can get to 100% in some areas sooner rather than later. Obviously, the other number we have to look at is how many families are out there right now that are completely virtual, that want to be completely virtual. That will impact the number of students that we have in the buildings. And depending on that number, it may change our reopening to 100% timeline for that. Matt Greep is with us, our Director of Health, Physical Education, and Athletics. I like that I say that title almost correctly every time, Mr. Greep. It makes me happy there for that. We've also had a subgroup on athletics and extracurricular, because when we're thinking about students in school and when we envisioning with them what school looks like, while yes, for them it's about academics and classes, but it's also about the entire day. It's about the things that happen after school. It's about the camaraderie that they have and doing all their clubs and activities from kindergarten through 12th grade. So really that's been their focus, and that's where we're trying to lead from, is how not to cancel things, how to keep things going, just reimagine them. So Mr. Greep, thanks for talking with us about your committee.
Yep, anytime, and good afternoon. So as Christine had mentioned, I've been facilitating our extracurricular advisory committee. We've talked about various components of extracurriculars, whether it's drama, music, having their concerts in the PM hours, to athletics, to clubs and organizations. And the first thing I'll talk about is athletics. Everybody knows, the majority of the people know that currently, as dictated by the Department of Health, SED and the governor, that interscholastic athletics are not permitted at this time. Therefore, they have postponed the fall season to September 21st. With that, we are expecting to receive more information and guidance as to what that's going to look like in the coming weeks. And that's going to be very specific. It's going to be very straightforward. If they decide to postpone again, we'll go into a condensed season model starting January 4th, where we'll get all 3 seasons still in. It's just going to have a different look and a different feel to it. But again, we'll have more information that's forthcoming, and we'll get that out to everyone as soon as we receive word. So the majority of our focus has been on extracurricular activities such as clubs and organizations, because the state guidance has been that we can have those activities when we return to school. Now, what that's going to look like and feel like is to be determined yet. But that has been part of the larger part of our conversations. And one of the things that we had just created in our 4th meeting was a survey that we sent out to all our advisors. And if, for those who know, we have over 40 student clubs and organizations, and our advisors have been great getting that survey back to us. Right now, I'm looking at it, and we have almost 40 of those surveys returned to us. And that survey is focusing on our advisors, the ones that are in the thick of it, what it looks like, what it feels like, you know, the what, when, how, who, where, how, all the basic logistics of what that's going to look like. And that survey is going to help guide our conversation and our guidance from the district to continue to implement these activities. Because as Christine said, that, you know, we want to give our kids as many opportunities as possible. And we all know the benefits of extracurricular activities. You know, they improve academic performance, they improve attendance, self-confidence, and just that social emotional piece that we've missed out on the last 5 months. So again, more information is forthcoming. With that, we will have a plan. It is our goal to offer those clubs and activities to our students K through 12 as best we can. We want to be able to facilitate that and support it, and start giving opportunities back to our students. We are going to continue to meet. Our next meeting is going to be August 11th once we receive more guidance from the governor and state ed. So, you know, once we return to school, probably in the later part of August, we will definitely have a platform and an outline as to what our offerings are going to be. Last thing before I turn it back over is we are going to recommend to all our advisors that we delay our start dates of extracurricular activities into the month of October. That way, when we do open up in September, our students, our teachers, parents, advisors, coaches, administrators, everybody has time to grow accustomed to the new schedule as to what that's going to look like. And then we can gradually start to sprinkle more responsibilities and commitments and opportunities in there for our students. So thank you.
Thanks, Mr. Griep. I will say there was one question related to athletics and the virtual learning model. One of the things that people want to know is, can they still participate in things if they're in the virtual learning model? The short answer is yes. However, the long answer, especially when it comes to sports and athletics, is if you are a medically vulnerable person, we would really want to talk with you about why you're choosing the virtual model but wanting to participate in sports. Because obviously, there's a one sentence in the governor's proposal right now, the 145-page document of state ed of, there are no sports right now. And so they are definitely more concerned with athletics returning than with anything else. And I think as we watch professional sports reopen, so are we. To be clear, the minute that we can safely have athletics, South Glens Falls is behind that, and we'll be doing everything we can to do that. I keep encouraging everyone to try to think out of the box so we can provide these opportunities. But as of right now, there are no athletics, and that's what we have to do for that. So before I get to any other subgroups, we've gone through 4 right now. I did want to mention, because I know there's been, we keep watching the numbers increase on who's on the virtual call. And so I did want to provide people who may have been a little bit late than 4 o'clock, if they would like to participate in the Padlet. This is the Padlet. They can put their phone up and do a QR code as well using their camera mode into that. I will answer just a couple more questions right now. One of the questions was very interesting to me on how it was worded. It says, if the governor recommends that all kids K-5 should be in school 100%, what will happen right off? And then somebody else wrote in response to the above question, how would that impact high school students? unless the Department of Health changes the must be 6 feet away for social distancing, they cannot possibly require all of us to be in person. We do not have space or capacity in our buildings the way that they are instructed right now to make that happen. Also, they are very clear in the state EdTech guidelines that we cannot add walls or do anything differently to the structure of our buildings unless we get that approved through state ed with the normal building procedures, and that takes months to do. So none of that can really happen there as well. So I appreciate that question, and obviously the Department of Health via the governor is also what drives all of our rules to this. But unless they give us a new document, that absolutely will not happen there for that. Somebody did write about how we're grouping students. We're trying to keep all of the families, regardless if you are in 2 different elementary buildings or an elementary and a middle school building, in the same group number. So there will be more to come on that, and we'll make sure that you get those numbers too immediately. And if we see one that's an error, we'll correct that as we're doing that. I'll get to staffing in just a little bit. There were 2 other questions that were out there before. Are COVID testings available for students and staff? Right now, I encourage any of my staff members and also my families that if you feel you need to be tested, you should contact your physician in that. Unlike certain essential workers, there is nothing there right now to say if you are a staff member of a school or a student, you just want to be tested. There is some open testing throughout our county, and I encourage you to look at the Saratoga County Department of Health page. But as of this time, they are not partnering with schools quite yet on that for that component. I don't know. I know some of you have been reading through the questions. Does anyone else see a question that maybe I need to answer right now before we move on to the next section? Oh, there is. Oh,
I was going to say there's again, we have a question that's on here, and this was answered before, but this person may have gotten on late. Will kids be punished for purposefully not social distancing, taking their mask off? So again, we will deal with any kind of situation like this where we have within our expectations in a building, which masking and social distancing will be a part of, that if students are consistently disregarding that, then we will follow up the same way we would follow up with any infraction of the code of conduct. So, it may start with a conversation. The assistant principals would likely be involved, some level of administration. There will be contact home with families. And then that will be escalated depending on whether the student turns things around or not. But yes, we will follow that up as we would with any infraction of the code of conduct.
And somebody did just ask if this is being recorded. This particular session we did not record all 3. We just wanted 1 for the record. So this particular one, and it will be available for replay on that. And also we are taking all of these questions that people are writing. So if we don't get to your exact question tonight, or you feel you skipped over it, we're trying to cover as many as possible. We're taking all of these from all 3 virtuals, and we're creating a family FAQ sheet that we're hoping to get out hopefully Monday. That gives us the weekend to answer all of the questions, because as of right now, there's 10 pages of questions. So we just want to make sure some are the same, but we want to make sure we do them correctly on that.
Miss Orr, it's not a question on here, but it came up in the other ones about, do parents have to pick the same choice for all the kids in their household?
Yes, thank you, Mrs. Covey. So for virtual school, that was one of the questions during the school support. If you have 3 children and 1 is medically vulnerable and you want 1 to be in a virtual school, but 2 to go to school in person, that is completely acceptable. It's not an all or nothing piece for a family. It is really about each student's personal needs and making sure we meet those personal needs. So when you register, you can register all of your kids or just 1 for that. There is a question on UPK for virtual learning. UPK is still slightly different than K through 12th grade. And really, especially in that first month, it's about getting them and making contact with them. There will be some recommendations for kind of virtual learning at home. If we have to go to 100% remote learning, absolutely, UPK will be involved in that. Mrs. Stellato has actually been doing separate trainings with the UPK teachers regularly to actually help improve those systems there for that. So again, there'll be more to come from UPK directly from Laura Gilder, the director, in schools there for that.
Ms. One question that I know people have been wondering is, we didn't address how we would be attempting to group kids. And somebody asked if we're grouping them in the cohorts alphabetically.
So the quick answer to that in South Glens Falls is no, it is not alphabetical. Two things may need to come into play. One, if people need transportation, our transportation department is actually contacting each family right now. There will be a survey going out that we need to finalize on a few things as well. So you can opt out of transportation this year in case you don't need it, or you'll be carpooling your family on that. But we are not grouping. We're trying to group so that way neighborhoods where we already know there may be contact between students, just simply because of the neighborhood setting, will be able to be transported together, but also be able to be in the same group. If you have a specific situation where you feel you need to be grouped with someone, whether it's carpooling or daycare or anything like that, please just write an email to your principal and they'll keep track of that right now. And when we get to finalized grouping, you will be able to see those assignments. There was a question on neck gaiters as an acceptable to face masks. I believe as of July 30th, neck gaiters are acceptable to face masks, as are bandanas, as of July 30th. I'm not sure that guidance will stay the same for schools in the next month, but face shields are not acceptable replacements for face masks. So with that said, I'm going to continue the next one. There's a few things on travel that I'll get to when we get to some of the other things. Technology. Technology is a big component of this because when we talk about, are we 100%, are we going virtual, what is all of this? No, we were very proud of that. We were already 1-to-1 6-12 and we were quickly got 1-to-1 5-12 through this. And we also gave all of our kindergarten through fourth people in need Chromebooks there. However, we know that's not enough, and we know we need to be exclusive with that. So our goal is to get to 1-to-1 K-12. Our goal is to do that the first day of school. We are waiting for several hundred Chromebooks to come in order to do that. We are hoping by mid-August to the end of August, we get that shipment, and then we're able to do that. So our goal is the first day of school. The reality of this goal is probably closer to sometime in September for making this happen. There will be family toolkits and how-to videos on that. This question will also be part of the survey to parents that we'll be sending out. So that way we're very clear on all of these components. Our next subgroup, and the person that we have on the line that has been doing a lot of work in this area, and when you look at our document, mental health is smack dab in the middle. And I think it's very fitting that it's there because as we talk about our themes, I really emphasize the mental health of our students being important. And as we reopen and reimagine, we know that students are going to have different places where they may be nervous and things like that. So this subgroup has been doing a lot of work here on that. Flora Covey is currently our CIO, our Chief Information Officer. She was a school psychologist in the district, and she will be telling you about the work that has been happening with the subgroup. So thanks, Flora.
Thanks, Ms. Orr. So our group met 4 times in the month of July, and we have about 10 to 12 people, K-12. We have teachers, we have administrators, psychologists, social workers, and school counselors on this group. And we really worked on defining what social emotional learning means from a K-12 perspective. How do we, incorporate those strategies into our daily practices instructionally? And how do we, give teachers and students and families supports for that? So one of our big tasks is to come up with a toolkit, which we will be rolling out, and it will be available to everyone with very specific resources on how to address each of those social emotional learning components, as well as some strategies on how to talk to your child about the pandemic, tips for returning back to school, and some, mindfulness and other activities. So we're hoping to be able to give that toolkit and to support all of our students, our families, and our staff.
Thank you, Flora. Transportation. I mentioned transportation in the numbers. I mentioned transportation a lot because we are a school that provides a lot of busing. The rules for state ed say that a certain mileage, and throughout the years here, we've actually reduced that mileage. So we provide transportation to any students in kindergarten through 5th grade that are less than a half a mile from the school. and anyone through 6th through 12th grade that are less than a mile from school for that. We need to, in order to get all students here, strictly enforce those this year. So if you're someone that has usually asked for different arrangements, please let the bus garage know, because we are having a hard time getting the students here to capacity for that with the number of students that we can only put on a bus. There was a question about if I don't need a bus, you can contact the bus garage. You can email them, sgfbus@sgfcsd.org. And we will, we'll put that link even in the Padlet if people need to, and you can let them know you're opting out for transportation. That will absolutely help us get to 100% quicker if we have those numbers there on that. But when a student comes on the bus, they have to wear a mask. They have to wear a mask the whole time they're on a bus. Every staff member has to wear a mask when the whole time they're on the bus. Basically, we're putting one student to a seat. Siblings can sit together for that. It says students should maintain social distancing of 6 feet. If for some reason we aren't 6 feet, they're already in a mask. So that takes care of that. We also are encouraging our students and our families to remain 6 feet while they're at bus stops and while loading and unloading. So we will work through all of that. We have a large training that we do with our bus drivers, and they will be trained in all areas of this summer. Every bus driver will wear a mask on the bus. Every bus aide will wear a monitor, will wear a face covering, and will have the option of a face shield for that. If any of our bus attendants need other PPE, such as gloves, a face shield, or any other type of equipment, they will be given to them. We will especially be giving this to our aides who help put on some of our special needs families and students on the buses. Plus, bus cleaning will be happening, and we'll be cleaning and disinfecting, and that has to happen daily and nightly. We will be cleaning between our AM runs and our PM runs. We will disinfecting once daily. That will usually be happening at night. Our bus drivers will be aware that they must clean all high touch areas after the AM and PM run. So if for some reason a student needs to grab onto the bar, those all things will be cleaned in between, and they will be there for that. So with that said, there were other things related to transportation, and I'm going to lump travel in here. One of the things that somebody asked was, how are we keeping track of travel plans for our staff members? We have a district staff travel policy that has been given to every one of our staff members. Any person that has traveled to any of the states must provide me notice of that, and they must quarantine for 14 days when they return. We do have some staff members that need to send their students back to school and to college in states where they will need to quarantine, and we'll be working with each staff member individually on that. Obviously, with any rule, sure, will there be a person that may not tell me? Usually when that's the case, somebody else usually lets me know. It is amazing. I always say to my staff members, if you don't tell me, usually somebody else does. So that will all be happening for me there, and that's how we're keeping track of that. We will also be sending out letters to parents when that 14-day piece is there to let them know that they should be practicing the 14-day travel quarantine. And if they're traveling to any of these following states, they will not be allowed back into school until their 14 days are up for that. If they get put on quarantine by the Department of Health, and that is a mandatory quarantine by them, I always get notified. So that component is there in the procedures as well on that. In that area. So that piece is there. There's also questions on group 1 and group 2. And as I said, we'll be working very hard to keep families, and if we need sitters and things together on that. Anything else from my group that are watching this that they want me to answer right now? Okay, then I will move through to food service. Food service, obviously, we know we need to provide breakfast and lunch for as many students as possible, and provide even a hot lunch each day for that. When we were completely virtual, that piece happened, and we were able to provide over 20,000 breakfasts and lunches to that. Now that we are in a hybrid model to start, it is important for us to keep track of in-person and then food available for off-site meal service. Right now, we know we need to be socially distanced, so there's lots of questions that come up of will we be using the cafeteria? The quick answer is possibly. Will the students be in the cafeteria every day? We are not sure at this time. There may be times where we have to provide food in classrooms, and that piece will all be worked out. And at the building level, that will all be communicated with you for that. There will be food service of grab and go, and grab and go doesn't mean a traditional grab and go where there's a yogurt and a cheese every day. What grab and go means is that I know one of the favorite meals of the high school is a crunchy chicken sandwich. Mr. Modi confirmed that with me yesterday. So those would still be offered, and that meal would still be there. However, it would be individually wrapped and placed in either a bag or a container, so that way students can quickly get that. We are going to a touchless system, and the touchless system is going to be there. So again, there's not one more high touch area by having students have to enter their number in for that. We are still working on our offsite meal service as to whether it'll be curbside and will be able to be utilized for students in need that need their meals on off days. Or our goal may be that if you are here on day 1 and you're not here on day 2, that we would provide a breakfast and a lunch for you to take home with you on day 1 to be eaten on day 2. So there's definitely more to come. And as we nail down the exact models, we'll be giving information to you there. Staffing solutions. This is a big one for us because with all the things that are going on and all of the extra added protocols that we need to keep in place, obviously we need more staff to do that, and that's always a concern. So the very first areas that we have been putting up temporary positions and looking to hire is in part-time nurses, cleaners, and transportation. We know we may need more bus runs. We know we may need more people in a different shift to completely reimagine how we clean the building. And obviously, we know that we're going to need more support for nurses because they are going to be doing more screening. Heaven forbid they have to deal with somebody that is a positive case. They have a lot on their plates for that. So we will continue to work with our district directors in these areas for that. We are always in a shortage of substitute teachers. So we're constantly looking for areas to think out of the box to teach in this model, and we will continue to do that. State Ed put out a document, though, that did increase the number of hours that somebody who's not certified can cover in uncertified areas, and that went from 5 hours to 10 hours. We try to use this as a last resort when we're covering things, so we will know that that is there for that, in that capacity. Our 10th area is on communications. This is our third town hall meet in this area. And if the need arises where, heaven forbid, we have to change our models again, we will do another town hall meet before the end of the year, or before the end of the summer, excuse me, on that. We will be having building level conversations, and there'll be more to come on that. At the district level, we know it's summer, and everyone is still trying to enjoy their summer. So we've been only trying to email once a week to families. We will continue to do that. Our website is now on Reopening and Reimagining, so you can always check there for information on that. From the district level, we will also be having more building level meetings, conversations, and emails. So you should be looking for principal emails on anything specific to each individual building on that. And obviously, if somebody signed up for virtual school, very shortly after August 7th, you'll be contacted about more information on what that looks and feels like for that piece there on that. So it is a goal of ours to be as transparent as we possibly can. I know that every person that has watched these virtual meetings right now are not happy with all of our decisions that we have to make as a district. Myself, Christine, as your superintendent, is not happy with all the decisions that I've had to make to lead this district in these times. However, we are tied to the rules of the Department of Health and the State Education Department, and we have to follow those. As soon as anything changes in those, we will always be modifying our plan to the best of our ability. And again, our goal is to get our students to 100% as quickly as possible. Our last and 11th piece before I answer some questions and I turn it over to anyone on the group that can answer questions is in before and after school care. This has to be part of the plan that we submit to State Ed, and quite honestly, I'm glad it's there. We have a very good working relationship with Moreau Community Center, and we provide before and after school care in all 4 of our buildings. We will continue to do that and make sure that is happening there. There will be information that comes out directly from them on how to sign up and register for that. But I can tell you that we've had several meetings for them, and they're looking forward to seeing your students again. Because they're housed in our buildings, they have to follow the exact same screenings, PPE, health and safety plan, cleaning protocols, and et cetera. So they are all very clear on those. They will also be trained in those areas, and we'll be working with them directly. So once we know the exact model and we get it to Donna at the Monroe Community Center, she will be sending information out about before and after school care to anyone who's interested, and I would continue to check their website on that. Finally, how do we reopen? Everything from this point forward is tentative and subject to change, and revisions are made as we continue to gather data. As I said, our goal is to get to 100%. And so if we have data that allows us to do that, we'll make changes that we need to, and we'll communicate those with you. Also, we'll be constantly looking at the Department of Health websites, and if any things change there, we will let you know immediately for that. But these are the 11 areas that we will continue to focus on, and we will continue to communicate with you on. Your frequently asked questions will be subdivided into these 11 areas. Any questions that are similar to each other, we will try to answer as one question, so you don't have more than 10 pages of documents to read over in the FAQ section for that. Once we send out that FAQ section, we will be posting that online as well. And if other questions come in that we feel are different than what families have already submitted to us, we will continually go to that site and add that component in there. So with that said, we'll do one final round of questions from here. I don't know if anyone wants to share a few with me that they want me to answer.
So Ms. Orr, there's a couple that kind of surrounds notification if there is an infection or a positive. So maybe speaking about contact tracing and that piece.
Sure. So as I mentioned earlier, our school nurses have been trained in the Johns Hopkins contact tracing course. They work directly with the Saratoga County Department of Health, and as soon as we are notified either by the Department of Health because they have traced someone back to our school, or we have sent someone home and been notified by the Department of Health that someone is now positive, whether it's a student or staff member, they contact us. So it is not simply self-reporting by a student or staff member. We get contacted in every area by the Department of Health on that. The minute that that happens, contact tracing will already be taking place because we will know who's in the school and what student is around, but our nurses will assist with that for that. That needs to be done in hours, not days when you're dealing with a school district. So we will work as quickly as possible on that. And at times, we will notify families directly, or the Department of Health will do that. And that will either come from our school nurses, our district nurses, sometimes our principal, depending on how many that is there. So there are protocols. There is a containment plan that will be posted online beginning tomorrow. That's part of our larger plan. But the Department of Health for sure takes the lead on all contact tracing because they are the experts in it, and we support them as quickly as possible on that. I do know there were a couple questions on ventilation. And it's interesting, I just met today with our capital project committee on ventilation, and I know there's lots of questions around MERV filters. I've definitely learned more about MERV filters now than ever before. There are times when people are talking about MERV filters related to malls that talk about the highest level of MERV filters. One of the things that's our goal in a school district is to make sure we have the highest MERV filter that works with our ventilation system. And it's also about airflow in that. We are actually more than doubling the airflow beginning in September of how much clean air is turned around in our building and each classroom for that. So that is definitely based on the recommendations from the state. We have looked and reviewed all of our ventilation systems, and we're doing that. Obviously, we're looking at all windows and making sure that there are workable windows in each room. If we need to keep doors open, we will do that. We still have to be very mindful of our safety plans and the protocols and rules by state ed around that to do that. So we have been having weekly meetings around ventilation with the experts, and we will continue to be using them in that area on there.
Christine, there was a question about the Monroe Community Center Kids Corner staff also having to screen. I just wanted to reassure people that any adult that works in a function where they are in contact with our students would need to follow the same guidelines as staff that are employed by our district. So we work very closely with the Monroe Community Center and their executive director, Donna Nichols, and they will need to follow the same protocols.
Actually, and to add to that, we have a system, and we picked this particular system because anyone who's either not cleared or not submitted within 30 minutes of reporting to work generates a message, a report, and an email to all the supervisors and to myself. And so we make contact with every staff member who has not filled that out. We've already started that for a full week now, and our working out all of the bugs. So when we get back to 100% staff in the district, we will be working with that because they would have to be under our system. We would also get reports on the Monroe Community Center to ensure that that's taking place there, and they wouldn't be able to start their workday unless that is filled. Other questions?
There's a question here about changing your mind about if you are comfortable with a student being in school, and I think that's around virtual school. So folks are wondering, I saw a couple of questions like this about not enrolling in virtual school, starting in the hybrid model, and then realizing that they are uncomfortable with that. Will they be able to enroll themselves in virtual school?
Yeah, so that will be based on the numbers and what our seat capacity is to the virtual school at that time. We're also working as a region with our local BOCES on a virtual school model. So there will be more to come for that. Obviously, if somebody doesn't feel comfortable or if somebody's medical diagnosis changes while they're in the building, we want to make sure that that capacity is there, and we're working with that. There were also questions on fire drills and lockdown drills. Mr. Dawkins, I know you've been working with the principals on that. Can you reiterate some of the rules around that during this time?
I can. So it has been made clear to us that the rules around the number of fire drills and lockdown drills have not changed from the state education department. However, how those drills are performed is flexible. And so there are opportunities to perform fire drills with minimal staff in the building before school, after school, when events may, previous to events starting, things like that. And so we've received guidelines from our safety specialist through BOCES, and currently that has been forwarded on to our building principals and assistant principals, and they are working on coming up with plans in order to execute those drills throughout the fall and the spring. There are a certain number we have to do each fall and each spring, and so we are looking at creative ways to do that to also ensure that we are keeping our social distancing during those drills.
Geraldine, can you put the link to the virtual school in the Padlet, please? Because some people are asking for that information and it's already out there. It's not 100% complete, but it's complete enough where people would know exactly what we're trying to do with virtual school, and the registration is there for that. There was a question, and I know that somebody just wrote, the last comment was, I see a lot of people are concerned about staff following mask and distancing protocols. Would you address this, please? Of course I will address it. The Department of Health says in order for us to reopen, all employees must wear masks. It's really that simple. I meet with the Administrators Association, the Faculty Association, and the CSEA Association bi-weekly in the summer right now to discuss all the protocols. The staff has already had a meeting on this, and everyone has been told that masks are not optional, they are mandatory. The only time a staff member does not need to wear a mask is if they are not within 6 feet of another staff member, or if they are not around students. So where they will get their mask breaks is if they are alone, far enough away from someone on that component. So we have been very clear with our staff on this, and we will be addressing it because they really can't come back to the building unless they agree with the Department of Health guidelines on this for that piece. So, I appreciate everybody's concern. I continue to tell our staff to continue to practice wearing masks right now as they're out because we want to make sure they're back and ready to go for this at all times in this area. Also, fire drills we did. This one, Mr. Grieve, I just want you to read. Schools should be back at 100% in person before there's any discussion of athletics. Athletics that deviate from the 6 feet guidelines, as long as any of these restrictions are in place, put students even who don't participate at risk. I believe that September 21st is the hard deadline for athletics. And then if they, at that time, if they extend, they cancel until at least January. Is that true?
Yeah, so obviously it makes it very difficult to participate in competitive athletics with the social distancing guidelines in place right now. So they have pushed back the start date, and that's for any activity right now, September 21st. They have said that that's still to be determined. They're still hoping that with the decision that comes through with the governor, that sticks. But if it gets postponed once more, then we will have 3 condensed seasons starting January 4th. Again, it's still up in the air, as Ms. Orr said earlier. If you read through the state guidelines and the return to school plans, there is one single sentence about athletics. So their primary concern right now is just getting students back into the school system, into the in some sort of traditional educational structure.
So there's a question about social distancing in middle school and high school hallways, and I'm really going to extend this to all school building hallways in this area. And for hallways, there is guidelines in the Department of Health of when we cannot keep physical distancing. Masks must be worn. What we're also working on at each building level is how we can stagger the movement between classes, so that way not as many students are in the hall at one time. We will be at 50%, 6th through 12th grade to start the year. So that means only half of the students are in the building. And then when we look at the structure of that, we'll be working on that. Mr. Modi has actually started looking at a map for his building on if certain hallways should be one way. How can we do that to also limit the cross paths for that? I do want to let you know that as part of contact tracing, though, it is a belief that that quick connection, as long as the masks are on in the hallway, does not relate to a pure contact. And I know there were a lot of questions here on contact tracing and all of that. As of right now, what we say to people is our students will be wearing a mask and they will be 6 feet apart. If these things don't happen for a longer period of time, those are part of the contact tracing study. I am not an expert on this. The Saratoga County Department of Health is. I sit on a subgroup, though, with them and our local BOCES, and next week we are meeting with them to try to develop better guidelines to help schools talk with families on this.
Ms. Orr, I see some level of frustration in the Padlet right now from folks who are concerned that we're not getting to all of the questions, and who seem to be putting out that, you know, there are a certain number of questions and are kind of insinuating that we're ignoring certain questions. I guess I just want folks to understand that we're doing the best that we can here. And part of that is keeping track of all of the questions that are being asked in the Padlet. So whether or not the questions get answered by us right in this moment, your questions will be answered and addressed. We are presenting to you at the same time as we're trying to monitor the questions that are coming in at the documents, and we are balancing a lot of things right now. We have our communication specialist, Monica Lester, who is also monitoring the Padlet. She is taking every single one of the questions and comments that have been posted on there. We are creating a frequently asked question document that we are taking all of the questions from all 3 of our reopening presentations, and we will be publishing that frequently asked question document for all families to see the answers. So we understand that you're anxious. We are also anxious, okay? We also want to make sure we're doing this right. We want to make sure we're keeping everyone safe. And we are not ignoring any of the questions. We will get to your questions. If we don't get to them in this meeting, please check that frequently asked questions document. Your question will be answered. If the question is still not answered to your liking, you are more than welcome to reach out to any of us, and we will, if we don't have the answer for you, we will find the answer for you.
Thank you, Mr. Dawkins. And he is correct. And on top of that, someone did ask about this presentation. Now that we are complete with all of our virtual town halls, and at the very least, we know that whoever's attempted to hear has heard, we will be posting this on our reopening documents as well. So I expect that as soon as tomorrow to be able to get that out there for that. There were questions on virtual orientations at the building level. Principals are working with their faculty on that, and there will be more information to come. We know that normally during superintendent's conference days, we let students in the buildings to get adjusted to their classrooms, and we also let them in to do supplies. I can't tell you yes or no that that's happening or not happening. We want some of our students to feel as comfortable as possible. We're just trying to tweak how we do that, especially for our 5th graders going to 6th grade and our 8th graders going to 9th grade and our newest kindergarten members. So there will be more to come on all of those things. The last question that I saw was on contact tracing with students in bathrooms. Actually, we're putting protocols together where every person must keep a sign out sheet with times of who has going to the bathroom at that time. So at the elementary school, there's lots of classrooms with bathrooms, but at certain buildings, like as Ballard as an example, in the new wing, there are no bathrooms attached to that. So all of those teachers will be required to do that. Those will be collected almost daily. and saved in the nurse's office to assist with the contact tracing. So we are doing everything we can to try to keep track of as many crossovers as possible on those things.
I'm muted. One more question that just came in was about, will immunocompromised students get a higher priority when deciding to enroll in online school later in the year? I guess I just want to make clear too that we're not limiting who can enroll in online school right now. Whether you're immune compromised or you're just uncomfortable with having your student in a public school building right now, that is your choice. We're not limiting that right now. As situations change, if you become aware of a health situation that may put your child at risk, of course, we are open to discussion, and you should start with contacting your building principal, and we will work with you for that.
And then I did have one other question on medications. Again, this will be part of the building conversations on how to deliver school medications, but we know that families need to deliver them. We know we need to give them to our students while they're in the building. So our nurses are ready and available. And my guess is they will probably be collecting them even during those first 2 superintendent's conference days, so we can have them there for the beginning of school on that. So as Mr. Dawkins said, let's see, there was one more. As Mr. Dawkins said, we know we have at least 10 pages of FAQ, and we will be adding these tonight to do that. Because of the number of questions, we expect to be working through the weekend on all of these questions. So we will be emailing all families in the district, not just the ones that attended. The FAQ, our goal is on Monday for that. Please check the website whenever you can. And most importantly, thank you. Thank you for participating. Thank you for asking the questions. We don't know. We know our plan's not perfect. We know that there's lots of questions and holes along with it, and we want to be as clear as possible on that. Also, as Mr. Dawkins said, you can always reach out to any of us. I see there are drastic concerns on this particular one about to ensure that our staff is doing the most they can. And obviously, that is one of our goals, and we will continue to communicate with them, and we will share the family FAQ with our staff as well, so they know where your top priorities are around this. So with that said, I'm going to turn off the recording first.